Hi everyone, Allan here. Today we would be talking about autoimmune conditions, briefly anyway. So there are currently around 80 autoimmune conditions worldwide. In New Zealand, there are hundreds, thousands of people actually with autoimmune conditions. Rheumatoid arthritis alone has around more than 100,000 people diagnosed with that condition. So some of the contents that we would be talking here would be is what is autoimmunity, some examples, causes, signs and symptoms, treatment options out there, COVID-19 vaccinations, and other people that would be able to help you. The person, you are currently looking at in this picture is Paul Elric. So he is a doctor, a biologist. He led the pioneering work in hematology, immunology, antibacterial chemotherapy. It was in his laboratory wherein the first real treatment for syphilis was actually discovered. His methods actually helped identify the different blood cells, blood types in the body. And as you can see from that slide, he actually won the Nobel Prize in Physiology and Medicine in 1908. And you could probably say that he is one of the greats when it comes to the field of medical science in the 20th century. He also did not believe in autoimmunity. So some people believe this set back the study for years, and it wasn't until the 1950s wherein there was irrefutable evidence of autoimmunity until it was really accepted. So what is autoimmunity? So I am not an immunologist. I'll try to explain it the best way I can. So our body constantly protects us from the outside world against viruses, bacteria, parasite, toxins. There are some cases that these foreign bodies actually enter. And in this case, enter our body. In this case, maybe a broken skin. We might inhale them. We might digest contaminated foods. So in this case, we have our immune system that can actually protect us against this foreign invaders, or we'll call them antigens. Antigens is just any substance that causes the immune system to produce antibodies. So these antibodies would actually attach itself to this. It's a type of protein that would attach itself to this foreign invaders, this antigen, and this would help the other cells in the immune system to actually identify, attack, and ultimately destroy them. The problem is our immune system can malfunction and can actually produce autoantibodies that would, attack our own cells. So that would be a good explanation, a brief, a simple explanation of what autoimmunity is. And the resulting chronic inflammation actually causes a lot of problems. That inflammation causes damages to the tissue, cells, and organs in the body. So some examples of autoimmune conditions would be type 1 diabetes. In this case, the immune system would attack the beta cells of the pancreas, and this is the one that actually would produce the insulin. And in celiac disease, people who would ingest gluten, the immune system would react to this gluten, causing problems, also damages to the linings in the small intestine. With multiple sclerosis, the immune system mainly attacks the myelin sheath that covers the nerve fibers. So the myelin sheath would be like the insulation of electrical wires. So when they are damaged, the messages between the nerve fibers and the brain would be considerably slowed down if blocked altogether. Autoimmune conditions which causes arthritis in this case would be rheumatoid arthritis. We mentioned it briefly at the start that there are around more than 100,000 people with it mainly attacks the synovial membrane. So these are the specialized connective tissue that actually produce fluids that help lubricate our joints. In the case of lupus, the immune system attacks, several organs in the body. Psoriatic arthritis occurs in around 30% of the people with the skin condition psoriasis. Ankylosing spondylitis mainly affects the person's spine, and juvenile idiopathic arthritis, which would affect children up to the age of 16. So possible causes of autoimmune conditions. So there is that genetic factor to it, or if we have a relative that has been diagnosed with an autoimmune condition, it certainly would increase our chance of developing it. But even then, it's not really a guarantee that you would have it. It's not like the color of our parents' hair. Even twins, when one twin might have an autoimmune condition, while the other twin, might not have it. So, in the case of ankylosing spondylitis, they noticed that 90% of the people with this condition have that gene HLA-B27, and when they probably found it out, they were thinking, yep, that's probably the thing that caused it, because most people who have that condition has that gene. But a lot of people who actually have that gene, which comprise around 8% of the population, wouldn't even develop ankylosing spondylitis. So they know it's a factor. It is a factor, but something probably helped triggered it. Environmental factors would be bacterial infection, drugs, viral infection, hormones. They have noticed that there are actually more women that have autoimmune condition. So they did studies and they found out that estrogen actually has an immuno-enhancing effect, while testosterone actually has an immunosuppressive effect. So it just means that the women's immune system is actually better in fighting off these foreign invaders. But it's a double-edged sword. So when it does malfunction, it does a really cause damage to the body, and that's why you've never heard of the term woman flu and only man flu. So other causes is food. Some people feel like food causes their condition to become worse. So there are people who have actually written books about this. So it's one thing to you have to look at. Other possible causes would be pollutants. Let's say smoking. Some studies have pointed out that smoking can increase the chance of you developing rheumatoid arthritis by up to 40 times, increase your chance of up to 40 times. So other more controversial theories out there is the hygiene hypothesis that kids should be exposed to germs and infections that would help their immune system develop better, and that by not doing it, it causes it to malfunction later on in life. One more thing probably would be the leaky gut syndrome, wherein they feel like toxins are coming out from the gut, marking some of our tissues, so the body would not be able to identify them as its own self. But probably the best or real answer is actually we just don't know. So at the moment, with the tests that are available for us, we don't know really what's causing autoimmune conditions. Some of the signs and symptoms of autoimmune conditions would be fatigue. Yeah, for some people, this is actually worse than the pain, because from being able to do marathons, they're unable to even just get out of bed and get the mail from their mailbox. Low-grade fever would be present because of the inflammation happening to the body. Muscle aches and joint pain would be present. There would be rashes sometimes in the areas of the skin because there's actually inflammation happening in that area. You could probably include feeling low, or down, because with this condition, you just don't know when it can, have a flare up. You might make a plan, plans ahead, go somewhere on that day, book the flights, book your accommodations, and then you have a flare up and you're unable to do it. So it's hard to be in a good mood when you do have these conditions. Some of the treatment options you have there. So when you are seen by the GP, when they suspect you have an autoimmune condition, you would by a good oral history from you, a good physical exam, results of the laboratory test, you would be referred to the appropriate specialist. If your autoimmune condition has arthritis involved in it, you would be referred to a rheumatologist, and the rheumatologist would be able to diagnose you with that type of arthritis or not. If you are diagnosed, you would be given medications. The medications would help with the symptoms. Unfortunately, there is no cure for autoimmune conditions. The medications out there is to suppress the immune system, so it won't injure your body as much as without those medications. Nutrition may also play a factor, as we mentioned earlier. People have written books wherein they said certain diets or foods have help. I don't want to use the term cure, but have their autoimmune conditions in remission. So a general rule would probably be have a more plant-based and food-based diet. Avoid or decrease processed foods. Decrease eating red meat. Have more omega-3 fatty acids. Most of us would have an idea how to have a healthy eating, but it's just following it sometimes that's actually quite hard. Exercise or keeping active is another way to help manage an autoimmune condition. It is a balancing act. There might be times that you're having a flare up and you're unable to do any activities, and that's okay. Just rest for a while. The good things with exercise is it produces endorphins when we do exercise. So endorphins helps with pain. It helps with our mood. The hardest part of exercising is actually going there, especially now it's winter. You want to exercise in the morning. In my case, my son likes to go to the basketball like 7 a.m. on the weekend, and there have been times that I wasn't really keen on going there because it's just too cold. But in the times I actually went there, I'm happy that I'm actually there doing the exercise with him. And it's so rare actually to go to an exercise class and after that you actually regretted going there. More often than not, you actually had a good time. So it's exercise again is really, that's why exercise is quite important with the helping you with that mood. And exercise can actually also help us sleep better, which is very important if you have an autoimmune condition. Relieving stress, yes, stress is also a big factor when it comes to autoimmune conditions. So there have been studies wherein they showed that 80% of people actually noticed they had a stressful event for the onset of the condition. So, and I have talked to a lot of people wherein they had let's say a divorce before they had their autoimmune condition. They had a partner who got sick and they had to do more work in the household, taking care of the kids. People were in an abusive relationship. So, and then they had that autoimmune condition. So it is important that we have to manage stress. Sometimes there are a lot of stressors we cannot, get rid of. It's more on how we react to them that makes it worse. I have a close relative. The way she would react to stress is she would stress eat. And I would tell her, look, the problem with stress eating is after you've actually stress eaten, the problem you have is actually still there. Whatever you're stressed about, it's still there. Plus, you have to live with the consequences of that, of what you eat, which is probably not that healthy to begin with. That's why I was telling her maybe you should be stress eating with salad, But yeah, that wasn't too palatable for her. So Other stress relieving things you can do is probably, mindfulness, cognitive behavioral therapy, and something you can certainly talk to your doctor about that can, maybe they would have an idea to give you to the proper direction or to get this courses. So with regards to COVID-19, experts are still saying that the benefits outweigh the risk taking this vaccine. It's just important you need to check with your rheumatology team before you have the vaccine. There are cases wherein you have to withhold your medications before you have the COVID-19 vaccination. But even then, it's not actually a safety concern. It's more on making the vaccine more effective. Other, people that can help you is, a lot of them would mention earlier, is, your doctor. Certainly talk to your doctor if you are wanting to try certain supplements that are advertised to help with inflammation. Talk to your GP. Just check if whatever you're going to try would be actually safe for you to do. Of course, a specialist would be there. If the medication you have been prescribed isn't working or causing you a lot of side effects, they could always change it. Talk to your pharmacist. I've never really heard anything bad mentioned about the pharmacist, so they're actually very helpful. You can ask them about the supplements also that you're wanting to taking. They're quite familiar with the medications you would actually be having already anyway. So see a dietitian, maybe plan a anti-inflammatory diet with them. A physiotherapist, would be also quite helpful, helping you with the exercise regimen that would be quite correct for you. So it won't be too much and it won't be too little. You could also maybe see a naturopath, osteopath, so, and you could also call our 0800 number at 663 463. So thank you so much for listening and have a good day.